Nigeria is building a resilient health system. At the base of that resilience is the public health function to prevent outbreaks, epidemics, and hopefully prevent pandemics. We have many lessons from Ebola to COVID-19 and to many outbreaks that have occurred in our country. Those lessons, we had a chance today to reflect on them and to share them with China and other countries. Professor George Gao is a world-renowned public health scientist who came all the way from China, who was former Director General of the Chinese Center for Disease Control and Prevention, to share the lessons from China's perspective on the importance of preventing disease outbreaks in a multi-sectoral way. We had the Minister of Livestock, Minister of Agriculture, Minister of Environment, and ourselves, the Ministry of Health, and our technical agencies discuss how the intersection between animal health, environment, and human health drive new infectious diseases and emerging infectious diseases. There are important lessons about surveillance, about data, about preparedness, about ability to respond effectively, about engagement of communities, building trust among the population, new technologies, science and clinical research, clinical trials, so that we ensure the world is safe and our communities are safe. At the end of the day, public health security is very much linked to national security and economic security. And those are important points that are relevant for Nigeria, for Africa, and for the world. And I know that President Bola Ahmed Tinubu's administration is doing everything it can to ensure that we safeguard the health and well-being of Nigerians, as well as that of our neighbors and the global community. And we're very glad to have this interaction in this symposium with the scientists that came all the way from China. We are open to partner with every country which is interested in joining hands with us to build our public health capacity, whether it's China, whether it's other places in Asia, whether in Africa, whether in Europe, whether in North America. We are open to constructively engage with the world so that we build sound health systems based on good science that protects our populations but also to protect the world. Thank you.
Thank you so much.
Yes, Minister President.
Let's get to your view.
Oh, well, thank you very much. Of course, like you have mentioned, diagnostic is a key element. If you cannot pick what is the problem, you cannot address it. So the partnership that we're building today, this conversation, is going to help us to leverage, to improve the diagnostic capacity of the Nigeria public health system. Clearly, we have a lot that we can learn from China, just like China also have a lot that they can gain from us. You will recall that during the COVID-19 pandemic, the response of China was generally acknowledged as comprehensive and disciplined. And if you look at, despite the fact that China had one of the largest cases of COVID globally, the case fatality was significantly lower than several other countries, which is a testimony to the level of care and the level of response in that country. So going forward, the partnership will be expanded. We'll continue to follow up with it. And of course, if you look at the West African sub-region with a population of about, I think, close to 450 million, Nigeria is about 50% of that. So if you're able to do and work well with China in Nigeria, it will significantly affect the health security of the entire West African sub-region. So we're going to follow through with this to ensure that we move forward with it.
Thank you very much.
Thank you, sir. Prof, one good thing we've learned from all you've said is how China is protecting its pathogens and its data. What do you think Nigerians can learn in terms of protecting our pathogens and our data?
Oh, well, I think in general, the lessons we should learn, especially from this COVID-19, we should share in the data. All the data must be shared because if we, as I said earlier this morning, if we don't share the data, the viruses, they will share the data. This is why during COVID-19 pandemic, we have, all those variants, subvariants, alpha, beta, gamma, delta. So in general, the world, we should share the data. Another lesson we learned we should, especially from the very beginning, the WHO called all over the world, we must take ourselves with this tolerance and resilience. I came here, I realized that the resilient public health system here in Nigeria is very good. So this is something we also should learn from Nigeria for our China. So, for the other part, I think what we have done in China, think about your death fatality in Nigeria. You should try to improve your water supply, and also something for the toilet revolution. This is what we call toilet revolution. We should learn, from China. This is very important. Water supply is the key to improve for the public health, especially for the fast-growing economy like Nigeria. So I am expecting some more collaboration together with Nigeria, with my colleagues here. So let's work together, get the virus down, and have a better world, not the human being down. Thank you.
Thank you. All right, very good.
From the highlights of what happened today, with engagement with the prof. Now, what is the concrete value that this engagement is bringing to the table?
The knowledge exchange is invaluable among countries all over the world, and in this instance with the delegation from China. The joint effort that we will make to improve our public health capacity, training of healthcare workers in microbiology, in genomics and all that, we will explore how to do that, how we maintain our laboratories. And I think there are also, as you know, some pathogens like Lassa, monkeypox, Mpox in particular, where there are new tools. We would look at how Nigeria can contribute to global knowledge and how China's global knowledge can also contribute to Nigeria. Tomorrow we are going to visit the Irwa specialist teaching hospital in Irwa in Edo State, which is our infectious disease center of excellence. That's your village. And we have here earlier on Christian Happy, who is the director of the African Center for Genomics, which has the ability to sequence genomes, which has developed an antibody for Lassa, which is a very important innovation. Those are scientists doing very important hard work that has important implications not only here in Nigeria but all over the world. The technology that they will use, the technology transfer, only comes through dialogue such as this. It's not a transaction, it's about a relationship. It's a respectful relationship between countries of the world. It's in the spirit of solidarity. What we're doing, as she's mentioned, is trying to come together to protect each other, because we're as strong as the weakest link in our chain. If any country is not doing well, then that is a vulnerability for all of us. So we have to try to come together with all countries in the world, whether it's China, whether it's somewhere in Asia, whether it's India, whether it's in Africa, whether it's in Europe, whether it's the United Kingdom, whether it's the United States or Canada or Latin America. Every country must realize that we're interconnected and interdependent. We don't know when the next major pandemic will occur, whether flu or another, we don't know. So we have to be ready and be able to learn from each other and get ready. Otherwise, we can have a repeat of what happened. So that's the import of this, and it's part of building the public health capacity of Nigeria. Is pillar 4 of President Tinubu's health sector blueprint. If you know those 4 pillars: governance, health system, value chain, health security. This is about health security. Thank you.
Thank you very much.
Thank
So
you.
you didn't tell us what he will be doing about it.
Thank you.
So what we are doing here today is to take stock and then plan for the future. And that's why we have invited an infectious diseases professor of repute, Professor Georges Gard, who is a virologist and an immunologist. He was the former Centers for Disease Control Director in China. Of course, you will recall that in 2020, when COVID broke out, it was from China. And he was part of those that managed it even in China and globally. And he's well published, he's known well globally. So coming to Nigeria is also to share experiences, because as we all know, everybody is, we are just like one step away from any pandemic. You can't predict when it will happen. And the best way to be prepared is to prepare like yesterday, not today. So that's why this symposium we are having today is very important. We want to learn from him, and I'm sure that you can see that he also came with a delegation. Because even according to WHO report, Nigeria did very well in managing COVID when it happened, even with our limited resources. So we are here today to share lessons and to learn from them, and they also learn from us as a country. And as we begin to prepare to make sure that we block all the loopholes, not only for pandemics, but also for epidemic preparedness and response.
Yeah, so this symposium on pandemic preparedness and response is very critical and very timely. That we're having a collaboration and partnership regarding knowledge sharing, opportunities for research, to understand our landscape between China and Nigeria. I think is well fitting at this point in time. This symposium has provided a platform for us to share ideas, rub minds on the experiences regarding pandemic preparedness and response from the China perspective and also from the Nigerian perspective. As a participant in this meeting and also as a panelist, I've been able to gather a lot of experiences and knowledge on what we can do better and what we can do differently, and how context affects pandemic preparedness and response. And I believe that the majority of the participants, if not all the participants, and not just the participants, the systems that are involved in this symposium, i.e. the Federal Ministry of Health, the Nigerian Center for Disease Control, the One Health Ministry, the Ministry of Environment, the Ministry of Livestock and Agriculture, who are all participants in this meeting, have been able to make their own contributions and also get insights from the experience from experts in the academia, in the public sector, in the non-governmental organization. So this symposium is very timely, and I believe that the lessons that we have garnered from here will be used to influence public health policy as it relates to pandemic preparedness and response.
So please, could you introduce yourself, your name and your designation? If you can go ahead.
Yeah, thank you so much. This is a very important conference. Lessons pandemic and prepare and resource. So my name is Dr. Nico Wang from in China, Institute of Microbiology, Chinese Academic of Science. I'm also Secretary of Chinese vaccinology course. The course is the first time in China 5 years ago. Yes, every year we have about 18 trainees joins us for training. This is a global health for in the world. Pandemic is very important. I hope joining Africa training come to or China for training vaccinology course. This is an advanced course. Join us every year. I will hope from hospital and public health come to China, join us the vaccinology course. Thank